Good morning, everyone. Thank you all for coming. It's a great privilege and honor to be here. Thank you, Lynn, and thank you especially to Val and Naomi and Tim for this conference of a dream. Thank you. It's such a privilege to share the stage with these two eminent scholars, Jan Poppendieck and Liz Dowler, whose work has really shaped and informed and influenced my own. It's quite humbling. We've been asked to reflect on the social construction of food insecurity, and to do so, I'm going to start with my co-panelists' article, or book chapter, a book chapter written by Jan Poppendieck and published in 1995 in a collection entitled Eating Agendas, Food and Nutrition as Social Problems, edited by Donna Maurer and Jeff Sobel. In my estimation, Jan's chapter, Hunger in America, Typification and Response, is underappreciated. I've cited it several times in my own work, and I've tried to explain its logic, but I'm not sure I've ever succeeded. So I'm going to try again today. And I'm going to also try to build on the work that Jan has done by examining its relevance to Canada and expanding the time frame to contemporary times, and also to consider the impact of political ideology on the typification and response to the social problem of hunger or food insecurity. Jan draws on the fine tradition of social problem claims-making analysis, which emphasizes that the way an issue gets defined and framed or typified is critical to the response that is mounted. This is not that surprising. It's fairly easy to understand. But what is less well understood is that the available solutions shape the typification of the problem. This seems less rational and less logical. It doesn't really fit very well with our rather naive understandings of how evidence-based policy making happens, that we conduct research to understand the problem, we come up with a solution that best fixes the problem, and then we implement the solution. The students I teach have a hard time understanding that policy making is essentially a political process involving struggles over power, not a rational, logical one. As Jan points out, there are three general principles for how social problems are discovered. First of all, the awareness of the possibility of a solution is a precondition for the perception of a problem. Second, the nature of the available remedy contributes to the content of how it gets framed or typified. And thirdly, the typification that wins the competition for public attention tends to obscure competing typifications and forecloses the possibility of alternative solutions. The idea that the available solutions shape how the problem is framed, as I said, doesn't fit with our, what we would like to think how policy happens. However, it does resonate with an idea from an economist I seldom quote, Milton Friedman. For those of you who don't know him, Friedman was an influential US economist whose ideas have dramatically shaped our current neoliberal political climate, in which government and taxes are bad and the free market will solve all our problems. I would disagree with Friedman about almost everything, but there is one idea that I think he got right, and it fits with what Jan Poppendieck is telling us. Friedman said, "Only a crisis, actual or perceived, produces real change. When that crisis occurs, the actions that are taken depend on the ideas that are lying around. Our basic function is to develop alternatives to existing policies, to keep them alive and available until the politically impossible becomes the politically inevitable." Jan examines the typification of and response to hunger in three periods in US history when hunger was discovered or came into public consciousness and became an urgent social problem. The first great discovery of hunger was during the Great Depression in the 1930s. America was faced with the paradox of high rates of unemployment, poverty, and hunger at the same time as massive agricultural surpluses. The idea that stockpiles of food were going to waste or even being deliberately destroyed while millions of people were hungry was just too much for Americans to bear. While the government delayed on taking action, Poppendieck explains that the typification of the problem shifted subtly. Instead of hunger as a problem made intolerable by the ready availability of food to solve it, waste became a problem made intolerable by the context of hunger. Thus, the problem would be solved if the surplus, all that food that was in jeopardy of being wasted, was applied to the needs of the hungry. Thus, the idea that food is the public policy solution to the problem of hunger, rather than adequate income so that hungry people can buy their own food, rooted itself deeply in US consciousness. Even during the next great discovery in the 1960s, when hunger was typified as a denial of rights, it was seen as a failure of food assistance programs. In Canada, this idea that the solution was food rather than income did not take hold until the 1980s. For example, recent research by a master's student who was working with me suggests that despite the efforts of some in public health to implement a school meal program in Ontario in the post-Second World War period in response to poor nutrition among children living in poverty, one of the factors that may have posed a barrier to its implementation was the introduction of the family allowance, or the baby bonus, in 1945, an income solution to a problem of hunger. The baby bonus was Canada's first universal social security program, and it gave income directly to families to spend. There is some evidence that politicians thought that its introduction would take care of any problems of child undernutrition related to poverty. Similarly, in the late 1960s and early 1970s, when poverty and hunger were once again in the limelight in Canada and in the US claims makers framed the problem using the language and tactics of the civil rights movement of the time as the failure of government to ensure citizens' right to food. However, in Canada, Senator David Kroll's 1971 report of the Senate Committee on Poverty declared poverty to be our national shame and recommended a guaranteed annual income. In response, the federal government set up a guaranteed annual income experiment in Dauphin, Manitoba, tripled the baby bonus, and created the child tax credit, again, an income solution to this problem. These different national responses to the problem of hunger provide support for Jan's premise that the available solutions shape the typification of the problem. Perhaps there are multiple reasons that Canada never made it official policy to respond to hunger with food during these time periods. But for certain, we didn't have the reports of stockpiles of food going to waste that sparked a food solution to the problem of hunger. Those reports of stockpiles of food in the US stockpiles of food going to waste in the 1930s in the US set in motion a set of enduring programs that continue to limit the range of possible alternative responses. Programs that include the Food Stamp Program, now SNAP, the National School Breakfast Program, and the National School Lunch Program. In part, this reflects what policy scholars and political scientists call path dependency, that once a particular policy solution is put in place, it's very difficult to change because everyone involved is hemmed in by all these institutions and structures that just channel them along the established policy path. It also reflects Jan's third principle, that once a typification and solution is in place, it's almost impossible to consider alternative typifications and solutions. I remember as a somewhat naive master's student attending a meeting of the Society of Nutrition Educators in Portland, Oregon in 1994, and hearing a presentation by Kate Clancy about the problems with the food stamp program in the US. In asking a question, I introduced myself as a Canadian. I said, why doesn't the US just give people to buy food, give people money to buy their own food like we do in Canada? And Kate just stared at me, just kind of stunned. It was like this long pause, and she said, we're so far from that, we can't even imagine it. It's not as if this is a double negative, sorry. It's not as if we didn't have hunger or food insecurity in Canada. We also had reports of hunger during the periods that Jan studies in the US. The economic collapse during the Great Depression affected Canada almost as severely as the United States. During the worst years of the Great Depression, 1 in 5 Canadians depended on public relief, and this doesn't count those who were too proud to apply, and there would have been lots of those. The Prime Minister at the time, R.B. Bennett, declared that he wouldn't let anyone starve, and in response, he provided ad hoc emergency grants to the provinces to help the unemployed. The experiences of the Great Depression led directly to the introduction of unemployment insurance in 1940 and the family allowance in 1945. Similarly, the report of the Special Senate Committee on Poverty in Canada suggests that the poverty rate was in the 1960s was about 20%, and made special note of poor nutrition as a critical factor in poverty. The report states, "There is almost universal recognition that nutrition is a critical factor in poverty. Dietary inadequacies and undernutrition, combined with the other deprivations attendant on poverty, cause health deterioration. This sets up the cycle of decreased performance of all activities, mental apathy, and incapacity for initiative or self-help." This is 1971. The report goes on to quote the Director General of the Medical Services Branch of the Department of National Health and Welfare, who said, "Instead of continuing to pour money into health care to treat the diseases of poverty and provide health education, we might put the money to better use by alleviating poverty." In the end, the Special Senate Committee agreed and recommended a guaranteed annual income. So it was only in the 1980s that Canada began thinking about food rather than money as the solution to hunger. In turning to food as a solution, we also stopped understanding the problem as poverty. The idea of using food as a solution to hunger, I'm sorry to say, apologies to our American guests, was a direct import from the United States. The first food bank was opened in Canada in Edmonton in 1981 in the midst of a significant economic downturn after a consultation with the founder of the world's first food bank, John Van Hengel. He set up St. Mary's Food Bank in Phoenix, Arizona, to rescue edible food from the garbage and redistribute it to those who were hungry. And as Graham Riches has pointed out in his book, it's a really prescient book, in 1986, that within 4 years of Von Hengel's visit to Canada, there were almost 100 food banks in cities across the country. So I think we can trace it very directly and specifically to that visit. Food banks were set up as an emergency response to an emergency in the economic system, and at least some food bank founders expected that food banks would close once the economic emergency disappeared. As late as 1991, food banks in Toronto were still debating when and how they might close. Clearly, food banks have met too many needs, and not just the needs of those who are hungry. Food banks provide easy opportunities for corporate marketing disguised as social responsibility and philanthropy, and for ordinary citizens to demonstrate their moral worthiness. Although the National Organization of Food Banks Canada, and some of the largest food banks in the country call for public policies to address poverty, the idea that Canadian food banks might one day close has become practically and literally unthinkable. In the 1980s, for the first time, the US and Canadian typification and response to hunger converged. As Poppendieck points out, the solution to the problem was part of the definitional phase in at least 3 ways. First, and we saw this yesterday in Rachel's talk, first, the language of emergency helped to shape how the problem was defined. Second, to raise donations, food banks used images of poor people that were readily picked up by the media. And finally, the growth of food banks and the number of people they served was used to demonstrate the case for the need. Poppendieck argues that once the solution has shaped the understanding of the problem and has been put in place, it effectively obscures all other possible solutions and understandings of the problem. French theorist Michel Foucault would recognize this as a feature or characteristic of discourse. In his way of thinking, discourse is not just what we say, but how we think about things. And as he shows, the dominant discourse that is in place has the effect of making some things thinkable and sayable, and other things literally unthinkable and thus unsayable. The transition in Canada from thinking about money as a solution to hunger to thinking about food as the solution to hunger was accompanied by another transition in the broader political discourse from what scholars call welfare liberalism to neoliberalism. For what now seems an all too brief period of time during the post-Second World War period, Western industrial countries in Europe, Canada, the US, Australia, and New Zealand developed welfare state programs to look after their citizens, manifesting a sense of social solidarity and recognizing the common shared sociality of all. The welfare state reached its apotheosis in the Scandinavian countries and was least developed in the United States. It was in this time period that Canada developed what became its signature social program, Medicare. Just think for a minute of what it would take to develop something like Medicare in our current political climate. It's almost impossible to imagine, although some among us persist. This is the effect of discourse, to make some things seem possible while other things are impossible. The election of Margaret Thatcher in the UK in 1979 and Ronald Reagan in 1980 ushered in the era of neoliberalism, a shift in the broader political discourse that is still in full force. A central tenet of neoliberalism is that government should withdraw from any role in social programs. Margaret Thatcher famously said, "There's no such thing as society. There are individual men and women, and there are families. It is our duty to look after ourselves." Other planks of neoliberalism are tax cuts, which strangle the ability of governments to act, and the promotion of the free market, which facilitates corporate profit through deregulation, privatization, and free trade. As corporations have pursued profit as their singular goal, neoliberal policies have generated economic insecurity and instability for millions of people, while also destroying the social safety net that once made job losses and economic insecurity less frightening and less of a hardship. Neoliberalism promotes the idea that we're on our own, that we are responsible to look after ourselves, and that we will have to compete with everyone else for scarce resources. The competitive individualism fostered by neoliberalism is perhaps its most pernicious aspect because it undermines the very possibility of collective action, leaving us on our own, some of us in despair. Political theorist Nicholas Rose has argued that the rise of neoliberalism has led to the decline, if not the death, of the social, that government is no longer much concerned with promoting social cohesion or social justice. Instead, functions of government that were once held centrally have shifted to the level of communities. This has made possible the idea that communities would pick up the functions that were once reserved for government. Communities are now tasked with the job of feeding hungry people, whether through charitable programs like food banks and hot meal programs, or by helping people grow their own food in community gardens. Neoliberalism has limited our collective imaginations to conceive of a different future and limits our ability to act collectively. So how do we move forward? I'm not sure it's possible to create progressive public policy under a neoliberal regime, but we have lived now for almost 40 years under neoliberalism, and it will end sooner or later. Unfortunately, it's likely to come crashing down in crisis. Perhaps it will be another global financial or economic crisis. Perhaps it will be environmental crisis. Perhaps the catalyst for crisis has just been elected south of the border. Perhaps something else will precipitate crisis. So returning to Milton Friedman, what idea do we want to have lying around that will help us shape our understanding of the problem? Looking back over the past almost century of ideas, many so-called solutions to hunger and poverty are still lying around. Ideas about food solving the problem, food waste as the solution, the right to food as a solution. But the one that holds the most promise, in my estimation, is the idea of a basic income guarantee or a guaranteed annual income. I'm so convinced of the promise of a basic income as a solution to food insecurity that I co-founded the Kingston Action Group for a Basic Income Guarantee 3 years ago this month. In the 3 years that our group has been active, interest in this idea has exploded and increased exponentially. As you may know, the province of Ontario has now committed to running a pilot project, and Quebec is exploring the possibility of implementing basic income for the whole province. Part of the promise and the peril of basic income is that it is broad and slippery enough to accommodate a range of ideological perspectives. That means that it won't be a progressive basic income without a political struggle. But I think it's an idea worth struggling for. Our Kingston group imagines it as the Canadian Medicare of the 21st century, a program of which we will be proud and that we can't imagine living without. I believe it's an idea that can gain traction like Medicare because it is no longer about us and them. It's about all of us, as Liz just pointed out. Globalization, profound changes in the economic system, and technological changes have created income insecurity for millions of people, a significant contributing factor to the outcome of the recent election in the US. A basic income as part of a progressive renewal of our social safety net would provide a stabilizing economic floor and eliminate much of the insecurity. Just as importantly, it would help to break the stranglehold of neoliberalism on our collective imagination and give us a renewed sense of collectivity. We desperately need this sense of being able to work together to manifest a kinder, more compassionate, more just, and healthier society, and to solve some of our most pressing social, economic, environmental, and health problems. Thank you.